Well, what is this so-called public option? This has been the real problem that's been going on, and people arguing in the House of Representatives. The Senate says, no, we don't want a public option. And the House says, yes, we do want the public option. The public option is a government-run health insurance program that stands here supposedly in competition with the private insurance companies. But what it does is when somebody says you can keep your own private insurance, here's the problem your private insurance company would have to go through in order to be a viable option. Number one, your private insurance company would be grandfathered as to new enrollees, with the exception of dependents. Well, that's got to say something. You can't add anybody new. It's absolutely impossible to do that. Number two, the health, the medical choices commissioner, among other powers, will write the insurance policy. He has the authority to determine what goes in every insurance policy, and the private policy must have the same coverage as the public policy. He can determine the exact coverages and the nature and the extent of the coverages. And this is where the issue of rationing comes in. Because in the attempt to bring down the overall cost of health insurance, to squeeze everything out, the government will be working with a global dollar and saying within that global dollar everybody must fit, such as England. And what's happened in England is the recovery and cure rate of prostate cancer is 50%, 57%, as opposed to this country where it's 97%. In terms of outcomes, it's the same on every other form of cancer in terms of the healthcare system that we have. Well, what else does it do? It says that whenever anybody becomes a new employee, that employee must be given the insurance that has the lowest employee participation amount. Private companies will not be allowed to compete with the government option because the government option means that you have to have no profit involved in it, and when the employee comes in, he will be forced to go to the public option. Are you with me so far? Okay. Why would an employer have two insurance policies, the public option and the private? So the public option then becomes the only insurance policy that he will use. The other reason that private insurance companies will go away is that there's a provision in the bill, this is only through the first 30% of the bill, that says whenever an insurance company has any excess amount of money over what it took in as opposed to what it paid out in benefits, that money has to be remitted to the back to the beneficiaries. Well, what does that mean? Well, that means that you're forced to become a not-for-profit, and there's no money left in there. The other thing that it does, if an employer hires somebody to work for him, and that person says, "Look, John, thanks, but I don't need the insurance because I'm covered on my wife's policy," the employer nonetheless must pay a premium on the employee who turned down the insurance, and that premium goes into the health insurance exchange. That's what happens when you spend hours burying yourself into a bill. And I raised it up. I said, why would anybody want to have private insurance when you have to pay twice? You have to pay a premium on somebody, an employee, who actually turns down the coverage. And because that money would go into fund the so-called health insurance exchange. So there's no way possible a private insurance company could even survive. That puts everybody into the so-called public option. That means there's one insurance company left in America, and that's run by the people who refuse to be governed by that government.
Right. Okay. Same people that are